Treatment of sickle cell anemia. This is where I get so much interested, and this is where problems come in, and this is where people think I'm controversial. Now listen to this. Number one, pain management. So I have a question to you. When we are giving you NSAIDs, we're giving you the narcotics, we're giving you paracetamol to kill pain. Have we treated sickle cell? So when you give you paracetamol, when we give you diclofenac or ibuprofen, or we give you tramadol or morphine to kill the pain caused by sickle cell, have we treated sickle cell? So pain management is basically managing symptoms. Number two, blood transfusion. This one is of course an emergency one. You're getting worse, your kidneys are failing because of sugars, your red blood cell levels are going down, so transfusion can actually come in handy. And then when you have a risk of stroke, now we can do your transfusion. But even if we do your transfusion, how have we fixed the genetic mutations? I have a client who is undergoing dialysis, and they are told to feed before the dialysis sessions, and the hospital provides food. I want you to take if you have anybody who is undergoing dialysis, I want you to go and look at the plate that they are served with. Just look at that plate and you'll come back and tell me. And then there's sugar just alongside their bed, or soda. Why? Because they have been told, they have been made to fear dialysis. They have been told that sometimes, because you're coming here when you've eaten and your blood sugars are around 6, when you come here, when you do this dialysis, sometimes you will feel low blood sugars. Underline the word feel. So anytime this patient is experiencing a little confusion or some blood vision, it is now them to feel that this is low blood sugars. And guess what they do? You know, I have a feeling my blood sugars are going down. They rush to pick that soda and drink as dialysis is going on so that they can boost their blood glucose levels. Oh my goodness. How long do you think you're going to stay on that dialysis table? Before you drain your savings, how long do you think you're going to do those dialysis sessions as you take that soda? So look at it this way. We are actually trying to help you recover from a sugar problem through dialysis, and we feed you with sugar just because we feel that your blood sugars are going down. Because I don't remember, or you can tell me, when was the last time you're on dialysis table and then they take blood from your system and then they take a blood sugar test and they tell you your blood sugars are going down? Your relatives, your parents, your siblings, your children are undergoing dialysis. Go there and look at the plate. Look at the plate and tell me what is happening in hospitals. Your mother is admitted on that hospital bed with high blood sugars, and they're trying to give her insulin to bring down the blood sugars. But look at what the nutritionist has written in the notes. What are the nutritionist notes saying? Go to that file and look at the nutritionist notes. What are they saying? Then look at those notes and look at that nutritionist. Is she or he healthy? Look at that treatment guideline and look at that doctor. Is he or she healthy? Is he or she near a standard of health? But I understand at this moment in time, they have sold you a lot of fear. And you're so scared and you think that this is the end of life. If I don't take this soda, my sugars will go down and I'll collapse on this dialysis machine. But ask yourself, why are you on dialysis machine? Is it not because of diabetes? Is it not because of diabetes that you are taking this dialysis? So why would you feed diabetes? Why don't they give you eggs that are scrambled or fried with ghee? Now, why don't you carry food? Nobody will push this to you. You've already paid. Your insurance is actually catering for it. Why don't you carry food? Hospitali zitakata kwa insurance. Let them cut. Hata kama hawajakupea chakula, wacha wakate kwa insurance yako. But why don't you carry food? Why don't you carry for your father food? Why don't you carry for your mother or your aunt food? Why do you want to rely on foods that are served in the hospital? Amazing. Number 4, bone marrow transplant. And they say this is actually one of the most trusted, or one that is actually coming in handy to treat sickle cell. They are fixing the bone marrow. Well done. Have they fixed the mitochondria? We are doing a bone marrow transplant. Do away with the bone marrow and give you new bone marrow. Have we fixed the inflammation in the mitochondria? Have we changed the diet? Are we changing the bone marrow but not changing the diet? Have we? Good question, right? But again, I'm glad that this one they warned you. They told you bone marrow transplant is high risk. And this is where you sign a consent form, because the consent form is not supposed to protect you. No. The consent form is supposed to protect the doctor just in case you die. Hello? We knew that the consent is supposed to protect you, right? You actually sign it. Hey, please sign the consent before the doctor goes to the theater. You're quick to sign it because you're going to save lives. Now, my question is, do you think the consent form is coming in to protect you or protect the doctor in case you die? You will never understand this language if you've never suffered these conditions, if you've never gone through a surgery, if you've never had a patient, if you've never had a parent who has passed on because of these botched surgeries and these problems. You'll never understand it. You can't. If you've never signed a consent form, you'll never understand the language. At that moment in time, you're so desperate to just sign it so that the surgery is done. Sometimes you're in a position that you can't sign it, so somebody else has to sign it for you. And one day I said that most people die. Most people die in the theater, but these deaths are not recorded in the theater. They are recorded in the recovery room or in the ICU. Do you know why? I will not go into that. Most people die not because of appendicitis. They die because of a botched surgery for appendicitis. Thank you so much, Health Physicians. Thank you. Most people don't die in the ICU. People died in the theater. But because we want to protect the surgeon, because this is a well-known surgeon, right? He's a well-known surgeon. I mean, he has done all these surgeries. They are successful. So therefore, we have to protect him. The hospital has to protect them. And your consent that you signed protects them, not you. So the death will be recorded in the ICU. One day you will learn these things. And it's difficult for you to understand the language if you're not in the health system. Very difficult. Very difficult. But anyway, one day we shall be understood. Now, the next one. So we are talking about the treatments. So we said pain management. We said blood transfusion. We've said bone marrow transplant. Now, vaccines and antibiotics. Hey. Vaccines and antibiotics. Vaccines, you're actually taking a microorganisms that they've rendered it less harmful. And then you introduce it into the body so that the body produces antibodies or the immune cells against this bacteria or this virus. The question is, we've just said that sickle cell destroys the spleen, and the spleen carries the macrophages that actually destroy microorganisms. So the spleen is actually your immune system. So is the liver. And now we are introducing to you a vaccine. So they give you vaccines that actually introduce microorganisms. So which antibodies will be produced? Which organ will produce the antibodies? The liver that is failing because of multiple organ damage caused by the sickle cell, or the spleen that is actually failing again? And then we've said vaccines and antibiotics. We've talked about how antibiotics mess up your gut. And when they mess up your gut, they cause you low immunity because the gut microorganisms are part of your immune system. Now we've given you antibiotics that mess up the gut. We've given you a vaccine that actually is introducing dead or microorganisms that have been rendered less in toxicity, so that your body produces antibodies against them. But where is the body going to produce these antibodies from when the liver and the spleen are failing? When we are actually messing up the gut even further with antibiotics. How? So yes, some of these therapies are not supposed to help you change your life for the better. These are temporary therapies when you are suffering the complications of sickle cell. When you're getting into the complication of sickle cell, now you don't have an option. You'll take these ones, right? So why would you wait until you get to the complications? Why don't you just change your life now? Why? Please, why don't you just take health seriously and change your life now? Why would you wait until you get to complications and now you need hospital management for this condition? Your child has been diagnosed with sickle cell anemia. Change the diet instantly and just sit back and enjoy how your son or your daughter just survives. Look at that transformation. You will see it. Don't feed your children with multivitamin syrups that you want them to boost appetite. Don't give them appetite stimulants. Listen to their bodies. Give them food when they want food. Let them fast when they want to fast. When they ask for food, give them healthy foods. But all of you know that nowadays schools and hospitals are actually feeding diseases. Schools are the ones that told you that beans are proteins, right? Schools are the ones that actually introduced in your head, primary school, they introduced in your head, and it's difficult for you to forget that fruits have vitamins, right? But nothing about sugar. They're the same schools that told you that carbohydrates are needed for energy, right? Schools. And now your children are being taken to private schools and they eat sausages, MSG. They eat smokies. They have a special offer for rice and beans and whatever they're eating. All carbohydrates. They are given pasteurized milk, and you think you're civilized a parent, right? Even the gyms are feeding diseases. You're given fruits in the gym. You're given protein shakes in the gym. You're given energy drinks in the gym. So gyms, schools, and hospitals are actually feeding diseases. Time for us to unlearn. Hey, time for us to unlearn. Anyway, the last one is the folic supplement. I just saw somebody mentioning folic supplements. Yes, they are there. Now, I told you folic supplements are synthetic and the body struggles to assimilate synthetic products. Natural folate is in the beans. Natural folate, which is vitamin B9, is in the liver, the egg yolks, the green leafy vegetables. But you don't want to take these, right? You want to go for the folate supplements, thinking that these folate supplements are going to save your life, but still eat wheat. The point is you're forgetting that wheat messes up your gut, so you'll not be able to even liberate iron from that red meat or from those beetroots. You will not be able to even absorb enough iron because your gut wall is actually messed up. So you're thinking you can eat your wheat, enjoy it, because life is short, right? And we will all die one day. You're thinking you should continue eating your wheat, your seed oils, and then you can now fix that by taking an iron supplement that is synthetic, that will end up causing you constipation. So don't you listen. Food has natural form of folate. And folate is not folic acid. Folic acid is a synthetic form. Folate is the natural form. And folate is found in eggs, the liver, the green leafy vegetables, the fatty meats. You need it. It's there. And iron is in the red meats. Iron is in the liver again. Fix the gut and then eat healthy. You will liberate iron from that red meat because when you have strong acid, the iron is liberated. And then you'll absorb essential iron plus other amino acids through a very fixed wall, and now you'll not have these problems. But look at you. You take wheat, you end up having gastritis or the hyperacidity as you call it, and then you go and take an antacid suspension that actually neutralizes the stomach pH. Therefore, even protein digestion to release or liberate iron is a problem. So you are now having indigestion. Because you ate bad food, you went and took an antacid, and you went and took calcium supplements that actually bind iron, and now you are unable to absorb iron. Get this natural supplement from food. There is no supplement that is coming to change your life. Not even that favorite company that you're using. They are in business. They're in business. If they are not in business, they would have run a whole year session of just giving people supplements for free. Where did you see them running clinical trials on supplements? Where did you see a group of people being selected to go and take certain types of supplements so that they can change their life for the better? And then after that, now we have evidence that these supplements worked in these people. Now it can be used to this. That's why I told you supplements are actually classified as foods. So even if they don't go for clinical trials, you cannot sue the supplement companies because they're not drugs. Drugs are the ones that are supposed to be taken through clinical trials. But supplements are foods. And you cannot take food for clinical trials. Now, the last one is a drug that is called hydroxyurea. Hydroxyurea is a drug that was actually used in COVID. It was actually tested, not used. When they realized all these side effects are coming in, they withdrew it so fast. They withdrew it, and now you're taking it. What are the side effects of hydroxyurea? Because it's the drug that is actually being considered so deeply on this one. What are the side effects? Number one, bone marrow suppression. You know very well, what do we do here? We question. Bone marrow suppression. Remember, bone marrow suppression, the bone marrow is the one that is going to give you red blood cells. So when you suppress the bone marrow, where are you going to get the red blood cells from? And in sickle cell, you're actually needing, or you're in need of red blood cells. And the side effect of hydroxyurea is what? Eh? Am I loud? Backbench, are you able to hear me? So you are suffering from problems with red blood cells, and now you suppress the bone marrow. Wait. Number two, of course, GI problems. GI means gastrointestinal. So I'll say GIT problems, the gut problems. So if he's giving you gut problems, the question is easy. How are we going to absorb iron from the gut? Now keep in mind that hydroxyurea is an antineoplastic agent, is a drug that is used for cancer. Drugs that are used for cancer, they target rapidly multiplying cells. The mouth, when you bite yourself in the mouth, tomorrow your mouth is okay, because the cells in the mouth are actually rapidly multiplying. The gut, the bone marrow, the gonads, testes, and the ovaries, the skin, these are the cells that are rapidly multiplying. So when you use a drug that is supposed to target cancer cells, it actually ends up targeting these rapidly multiplying cells in your body. Therefore, the side effects will come related to those organs. If it's the skin, you will have a very bad skin, you will have hair loss. If it's in the mouth, you'll have mouth ulcers. If it's in the gut, you will have the gut problems, the ulcerations, the messed up pH, the vomiting and nausea. If it's in the gonads, of course, infertility is coming in, low sperm count. Infertility in women, both temporary and permanent infertility. If it's in the bone marrow, because the cells in the bone marrow are rapidly multiplying, we suppress the bone marrow multiplication, or the bone marrow suppression, which gives you more anemia, which gives you more deaths and more low immunity. So infections are coming in. Now you see those problems? So basically the side effects of hydroxyurea are the same side effects that we mentioned in the video that we talked about side effects of chemotherapy, because this is a chemotherapeutic agent. And if you see these, bone marrow suppression, gut problems, low immunity and high risk of infections, birth defects in pregnancy, very bad skin and darkening of the skin and the nails, hair loss, and then infertility. These are just the symptoms or the side effects of chemotherapeutic agents, the cancer drugs. So we don't even need to go there. So yes, the less the drugs in your life, the more your health. The less the number of drugs on the prescription, the less the drugs that you're using, the more your health. Actually, the super your health. Now, something called the carriers. The carriers are people who have one gene for this sickle cell. So yes, they are culturally called carriers. So these carriers don't experience any problem. They don't. But the problem is when they get low oxygen, when they are climbing a mountain or so. So high altitude but low oxygen. Or when they get dehydrated or into acidosis, these are the people who will get problems, because they will get defective red blood cells and now they will activate their problems. So if you're a carrier, most of them don't even know it. But it's even the blessing that you don't know this, because what you don't know will never hurt you. So what you need to do is simply fix your diet, fix your kitchen, start fasting, and let's move.